Well, now I'm going to introduce to you two of probably the most powerful Dutch women that we have. First of all, I'm going to introduce to you the minister, the Dutch minister for healthcare, welfare and sports, Miss Edith Schippers. She will be followed by a less powerful woman, and that is Miss Neelie Kroes, our special envoy of the Netherlands for startups. Thank you so much. So wonderful to have you two here. I think it's wonderful to have an interaction and a quick chat with the three of us. So first of all, we're here because obviously, e-health is taking enormous shape these days. We're also here to discuss the role of e-health in the Netherlands and your vision and view of the Netherlands as part of the bigger global ecosystem. So let me start by asking you, why is e-health so important? And perhaps Edith, you would like to start?
I'm really looking forward to more implementation of e-health, because we really need it for the sustainability, the financial sustainability of our healthcare system in the first place. And secondly, I think it's also very important because people empower. They can choose everywhere. They can book their hotel on internet. They can order their groceries on internet. And when you look at healthcare, you see that I have 2 punch cards in my wallet for hospitals. That is technology of the 50s of the last century. And I know we are changing very rapidly. And that enables people to be in the driver's seat, to really are in the center of the healthcare, and instead of going to healthcare, I predict that healthcare comes to the patient. And I think that is wonderful. I'm really looking forward to it.
Fantastic. And Neelie?
It's so fascinating with all those talented startups, and it was already mentioned before, that there are new ideas and there are new verbs, so to say. There is the verb, now you can Uber. And if you can translate Uber in this sector too, that would make a remarkable difference. And one of the startups, and now she is already trying in new startups, just have asked me the question and asked me to hand it over to Edith, for she was aware at the next women event, 1,000 women, entrepreneurs, inventors, researchers together in Amsterdam. And one of them just asked me, she is the founder, by the way, of Funda. And for the Dutch people, they are aware that that is the best to get your transparent information. Why not a Funda for health? So getting your information about what is at stake, what's possible as a patient, and also what the costs are. So if you are just adding that, all those new initiatives, then it would make life easier for Edith as a minister, and I'm certain that she will stay forever as a minister. So. Not forever, for there are other opportunities, but anyhow, we badly need you.
That's wonderful. So just going back to this empowering of the patients, right? That's going to happen, you know, more insight, better views, better information. What do you think is going to happen? Is e-health and are these new developments going to be driven by the consumer, by the patient, or by the doctors, nurses, and the hospitals?
I think mainly by the patients. Of course, many doctors and nurses already work with e-health, and they already have all kinds of ideas and maybe even startups in e-health. So I think, of course, we need both. But you see that in a free market, when you have a new technology or a new invention, then you can conquer with what already exists. In our healthcare system, we don't have a free market. So it goes much slower to introduce. It's harder to introduce. You see that if you introduce new technology, it adds up to what we already have. and instead of replacement. And therefore you see that it goes much slower in healthcare than it goes on a free market. But I really think we need this kind of new technologies, and therefore as a government we also try to stimulate. And I really think that this idea of a new funda will fasten the implementation, because if as a consumer you get good information, trustworthy information, then you can really choose. Then you can really be at the center of your own healthcare.
Yeah, no, that's great. Neelie?
I just had a meeting with Tim Cook, and at a certain moment he looked at my bracelet and he said, "You are old-fashioned, Neelie." And I said, "Pardon me?" And he said, "This is outdated." And I said, "Why, and what is the alternative?" And of course he took the opportunity to explain that Apple Watch and so on. And he said, and that was more important, I'm not in for that commercializing and so on. But what he was mentioning at stage at that moment is 5 years from now, or even a shorter period, we will be surprised about all those opportunities and possibilities, and that we are wondering, as a patient or a potential patient or just a citizen, that we are surprised that we could live without it, for then you are doing your own checkup, then you are taking your own actions up front. And that makes life much easier for the minister too, for then you are already taking into account that if you are sticking to a line that is unhealthy or that you are not listening to your own body, then you are making problems for yourself. So I completely agree that at the end of the day, it is the human being, it's us, and it is the market that has to be fed what we are interested in. And we are all interested in a longer, a healthier life, no doubt about that.
Yeah, and absolutely better quality of life. So I think this is going to be marvelous transformation of healthcare, where there's lots of sensor technology and lots of data appearing that can be analyzed and insights can be derived. But my question then is, how about the doctors? How about the nurses? Who's going to interpret the data, and do we need to re-educate doctors that way? And Edith, do you have a view on that, how we can change the curriculum?
Of course, I think that their profession will change. But that is not a problem if you are willing to change. It's also very exciting for the doctors too. I think that first of all we need to have standardization, we need to have one language. So if I measure with what kind of device you can think of, that it's already also in my record, which is with the doctor. And the doctor doesn't have to look every day to my record, but there's a beep or another signal that he has to act. So then we will improve healthcare. So I think that many doctors, of course, we have a whole new generation of doctors, and they are not against new technology. Of course not. They are working with it in all kinds, in all their life, in all other sectors. So they also want to work with it in their profession.
Absolutely, yeah.
And I think that new startups and new technologies really have to be developed with help of these doctors and with help of the patients, because if we have new technology, which the doctor thinks this will only make my work much worse, it adds up to administration, it's not very handy, then he won't use it. So if we develop new technology, please ask the doctor and the patient, what do you need? How can I help you to make your work more easy? And the same to the patient. What do you want? What do you want to use? So cooperation is key here, I think.
I think that's a great idea, and I think it's a good call out for startups, make software to make doctors' lives easier as well. But Neelie, I'm sure you're dying to say something.
Yes, I will take this opportunity for address the Dutch government, and I'm aware that they are aware of it. Therefore, you need digital competence. And digital competence is already needed at a very young age.
Yeah.
You need it in your curriculum in an educational system.
Yeah.
And by the way, don't only look at those youngsters, but also to the elderly. For they are interested. And I will never forget, and Maarten will be delighted when I'm just mentioning, if I get the opportunity to mention. My role model is a woman who passed away last year. And she was 92 when she passed away. She was Italian. She was involved in a robot research project with the universities in northern Italy. And she was part of that research team. And when I visited her and asked her, why are you interested in a robotics research project? She said, well, when I was 17, I just married my husband. And my husband was against education and was against traveling for women. And I followed him. And she said, when I was 72, that was my D-Day. And I said, your D-Day, 72? He passed away. And then she started education. She went to school, to the university, wrote books, and was involved in this research project. Completely open-minded and completely aware that age is nothing's never too late, so you have to act, and you have to act in the right way that Edith is mentioning.
Fantastic. Now, I think some great examples also how women could actually code from home. So that's another way that we can actually do both. I just want to talk about prevention. How can we actually use e-health to prevent illnesses, in your view?
I think it's extremely important because prevention, people think that a healthy life, to live healthily, is a little bit boring. If you ask people, this will be more the feeling of healthy living. And I think new technology can make healthy living exciting. It adds gaming to it. I saw so many startups that are really exciting. Also, for example, on an elderly age, when you...
Don't look at me.
No. I looked at your example. Because people in elderly home, if you see you need just a table, and you have a picture of a ball, and they can game with each other around the table with this ball, and they will have some exercise. And I saw it also with young children who are in the hospital who needed to exercise. It was very hard, the doctor told me, to really get these little children to exercise. But when it was a game, and you had a competitor, your comic hero was your competitor in a game, then it was really exciting to exercise. So I really think that we here are at the beginning of a whole new vision of prevention and of new life. Not only because we measure all kinds of things ourselves and this kind of prevention, but also because we can make live healthy exciting.
No, I think it's absolutely right. I would like to ask Neelie something quite different. In terms of sort of the global ecosystem, Neelie, you've seen so much, obviously, of the world, not just of Europe. How does the Netherlands compare to the rest of the world when it comes to e-health, in your view?
Well, we are top-notch, no doubt about that. But we are far too modest. And just skip the word modest out of your language and your vocabulary, but also out of your behaving. We do have so many excellent researchers, inventors, and specialists, and students, by the way, and startup. And I still remember at the start of Obama's first term in office, his administration was focused on health and e-health. And we were competing with Denmark or the Netherlands, and to just be an example for his administration. And Denmark won. Well, but that's not forever, so in the meantime, we are doing quite a good job. And I think that we should take this, for a couple of reasons, far more central in our policy. It is, by the way, great to serve society and to help, and what Edith is doing is really impressive, but it's also a great purpose for just pushing your economy. And we should just push that. And therefore, I'm pleading, don't have a ring-fenced research and university climate, but do it together with the university, the researchers, and the students, and the startups, and the corporates. And therefore, we introduce a program where the corporates, together with startups, and young Kees de Jager is just a pusher for that, that we are learning from each other, joining and sharing, and it was already said, but not ring fencing. And by the way, if you allow me to say so, also far more cooperation between the universities, and not if that university is treated, then I have the right to get the same treatment. Yeah. Come on, just make a difference. When someone is the best, treat him that is the center where the Nobel Prize winners are interested to come over and to teach.
Okay, let's get them here. I briefly wanted to, I have a question about from startup to scale up, essentially. Netherlands is a wonderful testbed. I've experienced that myself. Fantastic population to test on, and then we come to the stage of scale up. Very quick, 1 or 2 points. How do you think we can get there and we can improve that?
Like in other sectors, also in healthcare, we see not invented here is a problem. And you see that sometimes things really work very well, but it's hard to scale up because other hospitals will say, we have something in common, we have something like it, so we really want to develop our own tool. So I really think that cooperation is key here, and if somebody else invented something really good, please copy it. Copying is really the way we have to work. Secondly, I think that we need to I have many points, so I'm thinking which one I will choose. I really think that we have to open our system more. I started with temporary reimbursement. If you have invented something that is really promising, but you can't prove it, it's cost effectiveness, or it's a therapeutic added value, then you can temporarily be reimbursed. And I really think that we have to make this much bigger, because therefore startups get a chance to really do good research on a bigger population.
Great. Just one final question. I know time's up, but I'm dying to see what's on your smartphone in terms of medical apps, and can you tell us what you use? Before we go, I would love to have a look. No?
Well, my Nike band, and that is quite stimulating me, even if I'm late at home, to just walk or run another block, so that makes sense. But I misuse this opportunity. I would make a plea, and I'm copying what the CEO of ASML have said. Isn't it crazy in the Netherlands that we have 3 technical universities? Why not just putting them together? And
you can already mix right now.
By the way, you are my heroes for today, so go on. We need just a push. But it is not only talking about technical universities. It's such a small country, and it's a great country, but not like this. And what Edith was mentioning, we should copy others and not finding out our own territory and just making the Netherlands the best place on earth talking about e-health.
Well, I think that is a wonderful note to finish on. I think it's all about collaboration, cooperation, make sure we celebrate each other's success and that we can flourish as a nation and have a great impact worldwide and take other technologies and innovations into our country as well.
And don't be modest, for the presentations before were so impressive. So there is a lot to make a party about.
Fantastic. Thank you so much.
Okay.